Good morning.
Good morning. Thank you for being back.
Can everybody see? Can everybody see and hear?
We sure can. Absolutely perfectly. Thank you, Dr.
Wow.
Miracles never cease. How delightful. I was with Steve and his team last evening at the panel, and it's so nice to be with you again today. Now we've got a few minutes to really see if we can't really completely eliminate cardiovascular disease. So let's see if we can't get started. Anne, I just want to be sure we clear the air with this so you know that there are no financial conflicts. Now, I should share with you that about 10 years ago, I wrote an editorial for the American Journal of Cardiology that was entitled, "Is the Present Therapy for Coronary Artery Disease the Radical Mastectomy of the 21st Century?" Now, what did I mean by that? You know, it was actually in 1882 that William Halsted from Johns Hopkins devised the radical mastectomy. And that was an operation that removed not only the breast, all the skin over the breast, all the muscles under the breast, a radical lymph node dissection. It was disfiguring and painful. And many women preferred to simply watch the lump in the breast rather than have the radical mastectomy. And sadly, because Halsted was such a towering figure and he had such influence, and many of his residents became chairmen of surgical departments, that the radical mastectomy became a standardized surgical error for over 70 years, when at that time, there were courageous young surgeons who said, wait a minute, we think we can get equal results with much lesser procedures. And I wondered if that isn't really the same way it is in cardiovascular medicine today. When you think back, it was actually 40 years ago that we established stents and bypasses and a host of medications. And what have we done in the last 40 years? 40 years ago, cardiovascular disease was the leading cause of death of women and men in the United States. And today, it is still the #1 cause of death of women and men in the United States. And we really have to ask ourselves, is that the best that we can be? Because isn't this a sort of a standardized error when we haven't made any progress in 40 years? And we really have to look very carefully, because what you see on the slide in front of you is just an example of a number of cultures on the planet Earth where cardiovascular disease is virtually non-existent. And why? Because they thrive on whole food, plant-based nutrition, essentially without oil. If you were a cardiac surgeon and you decided that you were going to take your shingle and hang it out in Okinawa or rural China, the Papua Highlands, Central Africa, the Tarahumara in northern Mexico, forget it. You better plan on selling pencils. Why? They don't have cardiovascular disease for the reasons that we just discussed. So we really have to figure out a way to do a lot better. And so today, we're going to try to look at how that is something that we can do. Now, this is the oldest slide in my presentation. And I took this slide in 1968 when I was leaving Vietnam, having spent a year there as a combat surgeon. And this slide reminds me to tell the audience that if we autopsy our young GIs who have died in combat, roughly 80% of those average 20-year-olds will find out they already have evidence of coronary artery disease that they can see without a microscope. Not enough for their cardiac events yet, but nevertheless, here they are at that young age, already with early coronary disease. So that study was then repeated 45 years later by a group called the atherosclerosis in the young. And this was a study of men and women between the ages of 17 and 34, who had died of accidents, homicides, and suicides. Now, coronary artery disease in this young group is ubiquitous. Everybody. Again, not enough to have your cardiac events yet, but there it is, the disease at that young age already starting. So it's little surprise for a disease that begins to get its foundation in our late teenage years. It's no great surprise that by the time we hit our 40s and 50s, we begin to see this absolute tsunami of cardiovascular disease. Now, here is where we had a chance to really get it right. World War II. In World War II, it was characteristic that the Axis powers of Germany overran the Low Countries of Western Europe, of Holland and Belgium. They occupied Denmark and Norway. And it was characteristic that the Germans took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were gone. Now suddenly, these Western European nations were plant-based. And it was interesting that in 1951, Dr. Strom and Janssen, reporting in England's leading medical journal, The Lancet, they looked at the deaths from heart attack and stroke in Norway during this time period. So let's do this together. On this next slide, I want to have us focus first here on the lower left, where you can see in Norway in 1927, the deaths from heart attack and stroke were going up. By 1930, they were still going up. 1935, going up. 1939, in come the Germans. Whoop, 1940, whoop, 41. The sudden plunging of deaths. Who knew these Germans were these great public health educators? But look what happened in 1945 with the death of Adolf Hitler, the cessation of hostilities in the European theater. Once again, back comes the meat, back comes the dairy. Suddenly back come the strokes and back come the heart attacks. But sadly, we just didn't get it right.